everybody a minute or two to get on, but I'll start by thanking everybody for participating today. It's really great. This is our 5th session, and the first 4 really we covered the applications. The second one was on how to handle prescriptions, which we're going to revisit today because that's one of the things that comes up. And then I'm going to provide some additional background information on what we're doing to follow up on prescriptions that are either out of network with our current biller or the insurance companies are having an issue. And then we covered the clinical practice session, the third one, and call points. And then last week we talked about the clinical data, which Dr. Camarada was talked about the LU and the Nicolaitis studies, which are probably the premier studies, but all of you should have gotten a book of abstracts, which shows about 30 clinical studies that have been performed, and many of them in Europe. There's one that's in the US, which is very meaningful, and that was the LU study, which he covered. But today, what we're going to do, and again, I want to thank everybody. What we're trying to do is, all of you are very successful in selling, marketing medical products. Really, what we're trying to do is to really clearly show the difference between the VEINOPLUS and the competitive landscape. Why VEINOPLUS is superior in many respects to compression stockings or compression devices, other devices, where it can be used, where compression devices can't be used. And we're trying to put that information together because that's really what we have to convince the providers, the physicians, the reason to prescribe the VEINOPLUS to their patients. So today we're going to cover the billing and reimbursement update. We're going to touch briefly on, we sent out yesterday a couple of pieces. One is basically some of the sales advantages, the advantages of VEINOPLUS, and then you can call them talking points. We chose to call the second one VEINOPLUS Field Sales Guide. And then we're going to talk about selling to the VA. And then we want to have the last half of our session for questions. And we really want everybody to ask whatever questions come up, because this is our best format to learn what you're encountering in the field, which is the most important thing, and how we can support you properly answering those questions or dealing with the issues that you face. And again, if we don't cover your questions, we have a website, which is marketing at dynapulsemedical.com. If we don't cover your questions today, send those in. CC and Evan will cover them and get back to you with the answers. So we're going to start off today with, and I think everybody has their microphones muted, and I'm going to turn the program over to Wendy and Vin to go back through the VEINOPLUS medical prescription, how to handle it, and what the doctors require, what the biller requires to submit to Medicare or to the insurance companies. And I know it's a repeat, but that question has been coming up quite often. So we'll deal with that. And Wendy and Vin, if you want to start off, that'd be great.
Sure. I'll get it kicked off. So, yeah. So hi, everybody. Wendy, you can tell I'm driving, but I can do this in my sleep. And the reason why I can do this in my sleep is because it's always the same and it hasn't changed. And so it's super easy for me. But I'm going to go through this document. And if you'll just remember that everything that you need and everything that our billers need is right here listed for you. So let's start with what's at the top of the sheet of paper. It says medical prescription. This is the RX. This is the medical prescription. Your doctor does not have to get out their prescription notepad. Some of them still have that and write ordering VEINOPLUS, et cetera, et cetera, et cetera. This is it. So as we've simplified this a little bit and eliminated as much information as we can, because typically it's the MA or the nurse that's going to be filling this out. So very simply at the top of the page is the patient's name, first name, last name, their date of birth, and their cell phone. And having the cell phone on there is easy for you. If you're going to be calling the patient to let them know the status of, their coverage, or if you want to speak with the patient personally, as I've mentioned before, I actually do the training for the patient myself. It gives me the interaction with the patient, and then gives me a great reason to go back and talk to my provider or their provider regarding what the patient said, how it's working, and the results that they're seeing. All right, section number 2. The only 2 diagnosis codes that will be approved for insurance per the FDA are muscle disuse atrophy for the right leg. So your doctor needs to select one and or both of those diagnoses. We do have a lot of patients that we're only treating one leg. So that's a situation where they might only select the right leg versus the left. I want to remind you, a lot of your doctors may not have written this diagnosis code before. So if they're in their EMR and they type disc muscle, the first 2 diagnosis codes that pop up are unspecified or bilateral. And that's ending in .0 and .9. Those 2 will get kicked back. It has to be .561 or .562, right and or left, one and or the other. I'm going to stop there and see if anybody has any questions regarding that, because it's an important piece. It's also significant. These are the diagnosis codes that have to go in the patient's chart. And we'll talk about what that means. I've been getting several field questions regarding their chart notes. So I'm pausing for questions.
Wendy, can you hear me? This is Gene.
Hi, Gene.
Hi, how are you? Thanks again for yesterday.
My pleasure.
Well, thank you again. My phone or yours broke up when you're giving me that code. Can you repeat that, please, Wendy?
Do you have the diagnosis code in front of you? I mean, the prescription in front of you?
I do not. I can get it up on another machine, but I don't have it in front of me. No.
Okay. Can you see what Evan is sharing on the screen?
Let me look back here at Evan's page. Not yet.
And,
No.
and I'm not. Okay. So the diagnosis codes are M62.561 and or M62.562.
Okay. M62. That's what I was looking for. You had broken up earlier.
Okay.
Okay.
And then the third option there, and if y'all can follow along, either looking at your own copy of this or following along with what Evan is sharing, I think it'll be super helpful for you. The third box in section 2 is atrophy electrodes. So when we ship this, the VEINOPLUS, the device has a pair of electrodes in it, and then they also get 3 extra pair, and then every quarter we're sending them 3. So that actually is going to give them 13 pads that should last them a year if they're using them properly. So that box needs to be selected also. The next question on the RX says, is the nerve supply intact with the calf muscle? If it is not, VEINOPLUS does not work. So we are asking the doctor to validate that the patient has their new nerve supply intact. Any questions there? Okay, the prescription supplements. This is what I call the packet. This is the information that needs to go to the fax number that's at the bottom of the page to our biller. It's the copy of the physician's RX, which is this form that we're looking at. They can either scan it into their chart notes. I have one doctor, I get it separately as a standalone fax, along with, then they send me the chart notes, demographics, etc., directly from their EMR. So this is the physician RX, this form right here. We need the patient demographic sheet. I had questions about what that is. Well, that's the patient's name, address, email address, gender, date of birth, all those things that we took off the previous RX because we're going to get those in their demographics, and we don't want someone to have to be redundant and type them into this or print them onto the sheet of paper. If their demographic sheet does not include their insurance information, a lot of them do, we need a copy of their insurance card, front and back. And then last but not least, this is where I get a lot of other questions, the chart notes that number one have one or both of the diagnosis codes. And then we're asking the doctor to put into the chart note something similar to ordering muscle stimulator, VEINOPLUS for disuse muscle atrophy, either .562 and or .561. I have doctors who've made up different dialogue based on what they wanted to say. That we're just looking for ordering VEINOPLUS muscle stimulator and with the diagnosis code. That needs to be in the patient's chart notes. So what's the patient's chart notes? The patient's chart notes are what the doctor identifies about you and documents about you and your health on the day of service, on your visit to see the doctor. You go to see the doctor for your primary care physical every year. They take your blood pressure, your weight, they have your lab works. That's all go into that date of service chart notes for documentation. So those 4 things need to be faxed or emailed to the fax and or email that are listed at the bottom of this sheet. The order's at soliditymedical.com, or the fax number shown there is 844.444.1183.
Well, you can make a comment. What?
Absolutely, please.
The question comes up a lot from sales reps about these visit notes. And I equate it to, and unfortunately, I've been going to the doctors a lot lately. If you go, we probably all use, if you go to the doctor and you go into your portal after the visit, you'll see the visit notes. And if you click on those visit notes, that's essentially what we're talking about here, where it lists everything that went on in that visit. And this is some people are having a bit of a hard time with it, but all of this information is part of the doc's electronic medical record system. And so it's actually pretty easy for them to do. We all get it in our portals when we visit the doctor too. Go ahead, Wendy.
Thank you. I turned my camera off just because I'm moving locations for a minute. Does anybody have any comments or questions? We're getting a lot of these questions about these 2 things, specifically what the diagnosis codes are and what chart notes are. So I'm going to pause to see if anybody has any questions.
I'm muted. Thank you so much. Wow.
Right. I'm going to take that as a no. Below that is your doctor's or provider's discretion for how many sessions they want their patient to have a day. Now, Dr. Camarado has made recommendations that more frequent throughout the day, even if they're not an hour long, which is how long the device stays on before it turns off, is preferable. But your doctor can indicate to the patient, based on what they think the patient's compliance will be, how many sessions for how long. We recommend at minimum 2 to 3 for an hour each session. I tell my patients that they can actually, they're sitting in the evening watching the evening news or watching Jeopardy and they want to do 2 back-to-back sessions. That's better than not. But your doctor can make that decision and recommendation based on their own until they get to know the device and see the results. They're going to ask you for that. I would say the answer is a minimum of 2 to 3 sessions per day. If the patient can do up to an hour, even better for each of those sessions. Easy enough, right? Easy enough. It probably is going to be standard and typical. The doctor's going to sign it and recommend the same thing every time. That makes it super easy for all of us. All right. Below that is simply just the doctor's information. It's as simple as that. All we're doing there is we're just documenting the doctor's name, what their NPI is, and asking them, of course, the date, the address of the clinic, and their signature. For my doctors that repeat, I actually fill this in for them with the exception of their date and their signature, just to make it one less thing, easier for them to prescribe for me. That's something that you can do. You can do it in PDF form, right? And you can also, add text boxes to put your name and phone number at the bottom of the document as well. So if you're not familiar with how to do that in PDF form, certainly happy to help walk you through that, but it's pretty easy. But about 4 or 5 of my doctors, I fill this out for them, with the exception of course, the patient identifiers as well and the date of when they're writing the prescription. So again, section 3 is the packet. This is what the biller needs. They need this form, which is the prescription. They need the patient demographic sheet that has their address, their gender, their date of birth, all of those things in it. Their insurance card, if it's not listed in their demographic sheets, and then the chart notes from the visit. Vin, did I miss anything?
I don't think so. I think you did a great job. But this is the time to ask questions. It seems easy. It is easy, but we do get a fair amount of callback, especially with this the patient notes or the chart notes. So they can call them different things, but um, the 2 reasons prescriptions. I'll stress this: the 2 reasons, and Wendy will back me on this. Probably the 2 reasons prescriptions get sent back to you is needing more information, is they don't have the little phrase in there ordering the VEINOPLUS muscular, to treat those 2 codes, has to have that little phrase. And they don't check off the box and put the 2 codes in. And that and the insurance card. Some places forget the insurance cards. Those are the reasons it would get turned back to you. Is needing more information. So once the doctor's office gets it the first time, and it's probably helpful with you and them to make sure it's done right the first time, and then they'll get it, and it makes life a lot easier for you because you're not getting the callbacks from the biller saying, I need the insurance cards, or I need the codes, or I need the phrase. But that's all.
So let's talk about what happens when you send the packet in. Packet is the prescription, the patient's demographics, their insurance card or information, and their chart notes. It goes to Solidity initially. If it's Medicare, she's going to run it. Once she has approved the order, you will get an email from Taylor that says, I got this order, patient's covered at 100%. Are you ready for me to order? Or it may say, I got this order, patient has a copay. Their deductible is this, their out-of-pocket is this. Do you want to call the patient first? This is your personal relationship with your doctors. I choose to call the patient if they have out-of-pocket and confirm that they do want to pay that. Because the last thing I want is for them going back to their doctor and complaining that all of a sudden they're getting a bill and they weren't aware that that was happening. Again, your relationship with your doctor, y'all know your doctors well enough to know, and you can handle that part of it. But once you ship it, it's shipped within 48 hours and it's shipped directly to the patient. You can request from Taylor to get a notification that it has been shipped. If it is denied, Stefan's going to talk about, and it's not denied typically, but if the patient's insurance is out of network for any reason, we're working on some alternatives to push those through.
And this may be a good point, Stefan, for you to jump in, but I want to see if anybody has any questions about the process itself. Once you've gathered all the information and we have all the information and it gets sent into Taylor.
Okay.
Yeah,
But
I have
I think one
question.
thing I just wanted to point out is once the unit is shipped, a day after the patient gets it, we call to follow up. They don't always answer, so sometimes we have to call them several times. But the process is very important because we want to make sure they know how to use it. Now, there's a one-page sheet that goes in with the product, and then there's a user's manual inside. But I don't think we could be surprised that a lot of people don't look at either one. So we want to make sure that they know how to use it, go through it with them, and spend about 10 minutes. We're also going to be following up 30 days after the patient gets it to make sure they don't have any issues, because we don't want them going into the doctor and saying, well, I didn't know how to use it, or nobody contacted me. So we're contacting every patient, and we're training our shipping department, our fulfillment group to do that. Right now, we're doing it ourselves, but I think that's very important to follow up. I think a number of people had said this is really critical because we want to make sure the doctors know that we're following up with every patient. Now, the second part of this first part is we've been working with a second biller that, and I'll give you a quick background. In January, the Medicare put a moratorium on new Medicare audits. We have an NPI number in a file that we were waiting to get approved so we could make sure that the non-Medicare patients were getting the attention that we want to see. So we have a group there in Pittsburgh, Pennsylvania, that is considered number one or two, depending on who you talk to, the billers in the country, a company called MedWave. And what we're going to do every time that we get a word back from Solidity that they're out of network or there's an issue with the insurance company, we're following up. We're doing what they call single case agreements, and we've already sent a number of them to MedWave. So we want to make sure that if it's any way possible to get a unit to the patient, we're going to get it to them. We're not going to give up when somebody says it's out of network or, you know, the insurance company has an issue. What we're doing simultaneously, MedWave is starting to negotiate with the insurance carriers for national contracts. And their feeling is that the national contracts, when we get them, and it may take a while, but we're going to follow through, we will be able to get reimbursement that is equal to or more likely better than the Medicare payments. So we want to avoid, right now, we're following up, we're doing a double follow-up. We're not going to take no for an answer or it's out of network. So I just want to let you know, we signed an agreement with MedWave, I have, and we want them to follow up on anything where there's an issue. And I know that all of you have other products and you can sometimes experience the fact that Medicare and some of the insurance companies aren't always as forthcoming as they should be. And I was with my family doctor yesterday and we were just talking about some of those issues. And by the way, I was telling Wendy, the family practitioners are also a very good potential client base. My doctor, they have a fairly good sized practice called Northwest Family Physicians. And he asked me to drop off a unit and he says he has a lot of patients where they're not ready to be referred to a vascular surgeon, but they have venous insufficiency. He says in the population over 60, it's a very, very common situation for the patient to have venous insufficient peripheral arterial disease. So I just want to let you know, we're not going to let any prescription not be followed up on if we get either a denial or a out of network. The next topic, and I'm going to go through this fairly quickly. One of the questions that's come up is how can we improve the selling points. And really, we didn't call them sales points. This is what doesn't matter what industry you're in. You want to overcome objections. You want to educate people, patients. So we sent out two short pieces. Well, one is about 5 pages. I don't know. I consider that short, but some people may not. But it really goes through where are the advantages. And I know you probably haven't had a chance to take a look at them, but we would really welcome your feedback. The other one is a little bit shorter, and you can kind of see the value proposition with each doctor. DVT prevention, post-surgical DVT prevention. A lot of people don't realize that you really can't use a compression device with peripheral arterial disease if the ABI is less than 0.8. And this is one of the few ways that you can get that blood flowing because it's an active process as opposed to a passive. And I would really welcome everybody's feedback on that and anything else we put together. And I think we've sent out to most of you. If you haven't gotten them, let Cece and Evan know. They put together about 8 comparisons of the VEINOPLUS with other products on the market. And some of them are just to clear up confusion. Some people mistake the TENS unit for VEINOPLUS, or even the standard EMS units that are Chattanooga and Complex, and those that are basically muscle re-education or muscle programming products. There really isn't anything on the market. There's a couple that have some similar characteristics, but in terms of the overall application, VEINOPLUS is pretty unique. So welcome feedback on these and any suggestions you have. We get a lot of questions. Now the third part of our presentation today is the VA. And I asked Andy Dietrich, and Andy, if you want to introduce yourself, I think you spoke before to us. And I think Andy, you're on. Why don't you take a second and introduce yourself? Andy is involved with both the VA and the company we use for billing the VA. So, Andy, I'll let you introduce yourself if you would, please.
Hey, thanks, Stefan. And I apologize for not being on camera. I sustained a gash on my forehead today, so I'm not terribly
Playing
camera
volleyball,
worthy.
probably.
Besides, I usually break the camera anyway, Stefan, as you know, from my looks. But
Andy was a football player for West Point a few years ago. And he uses our VEINOPLUS personally. So go ahead, Andy. I just want to.
I do.
I would like one of your fancy lattes. Okay, yeah, in-house.
Yeah, it was a few years ago, but it's more like 20, which still feels like yesterday. But anyway, so as Stefan said, I do work with commercial sales in our industry with medical devices as well as healthcare software. And on top of that, work on government sales along with my wife Maggie, who you may have come across in some of your communications from some of the reps, and GS2, which is Government Solutions and Services, who owns the FSS contract, which is a federal supplies schedule contract to supply VEINOPLUS to the VA. So with that being said, just a couple big things when it comes to the VA. So one of the biggest differences when encountering the sales processes within the VA and hitting those sales points is, number one, each VA is effectively a standalone entity. And what I mean by that is, if you've gone to one VA, you've gone to one VA, which means that the Louisville VA is going to be different than the Indianapolis one, as well as South Bend, Marion, Indiana. And I live in Southern Indiana, so that's just my quick examples. Each one has a different process with either new products going through a committee, either that's the CPRC process, they're ordering through prosthetics. Some have a different ordering platform that they use. So one of the things that you need to hit when you go into these different VA hospitals to do your sales calls is to ask those clinicians what their internal processes are, because more often than not, and it's not always the case, but most of the times what I've encountered and my colleagues have encountered is going through the prosthetics office. The prosthetics office is typically the chief DME orderer and processor for each hospital. So they're the ones that are stocking the warehouses for all the different relative devices. So as long as the clinician has the FSS contract number and the product details, putting that in the patient chart, or using whatever internal system that they use, that is how they communicate to the prosthetics office or the ordering procurement arm to get that out to the VA patients. Being a veteran myself, as Stefan mentioned, I had to learn the system just so I could get products sent to me, which is how I was able to figure that out. But that being said, we did send out, and Stefan, I don't know if you sent out that one pager, but we did create, thank you for putting that up. We created a one pager that has all the information necessary for you to order within the VA. So that clinician, all they have to do is look at that information, the fax, the FSS, the email, and the phone number down there at the bottom. That's all they need to order. So it's a little bit less stringent than you would with the insurance payer and Medicare and other commercial payers, because the chart notes are, while they're relevant internally, they're not relevant to the ordering process. So it does make it a lot easier for those platforms. One other quick note is each VA is moving to what's called OR tracks, and typically that system is for OR access. So those reps that are going in with replacement joints and spinal fusion sets and bone grafts and those other surgery specific products used to have to sign on to OR tracks to provide all their certifications, flu shots, TB testing, blood-borne pathogens, etc., to get in and certify that they can access the OR. That has changed, and some VAs, the Louisville one specifically, as well as Cincinnati and Indianapolis, I get emails from all of those because I'm on the system. They require all vendors to go through OR tracks to get their vendor credentials to even walk through the buildings. They've had a lot, because there's so many different products and so many different sales reps in those buildings. They're trying to limit, or basically provide a minimum barrier to get people in there so they can limit the number of reps walking around the halls of a VA hospital where people are trying to receive care. So keep that in mind as you're going through, and Stefan can share my email address with GS2, and we are, Maggie, myself, and Blaine Hedges, Colonel Blaine Hedges, who's the CEO of GS2. We are more than happy to, and I think I owe Lauren, I think it's Lauren's or somebody to hop on a call to talk about VA sales, but we're more than happy to jump on a quick 15 to 30 minute call and go through some procedures and talk through the specifics of your VAs so that we can help you make those sales if that's one of your call points. But I just said a lot, so I'll shut up and open it up for any questions on that point.
Hey, Andy, it's Blake Wilson in Colorado. It sounds like you've had a lot of experience with the VA. Can you share the different types of products you've sold? And is the same requirement? I've been a device rep forever, but mostly spinal implants, never into the VA for spinal implants. However, will the same requirements be applied to us as a VEINOPLUS rep if that's all we're walking into the VA with, or is it going to be different than a med device rep that's in the OR?
So Blake, good question. And if you ever remember those old Hair Club for Men commercials where the guy on the spokesperson for the Hair Club for Men said, "I'm not only the president, I'm also a client." He was a bald guy that received hair. That's one of the biggest reasons I think I mentioned, like I have the experience through the VA. So I've sold TENS units in there. I've sold other pain relief devices.
Okay.
So it's so mainly DME, right? So I haven't done the surgery process, but I had to sign on to OR tracks just so they would even have a conversation with me.
So
And a lot of times what OR tracks provides you with, and it's good, and it's about $360 for the year
yeah.
to sign up for it, but you're able to access and request meetings through there.
Okay. So it's a lot of like the credentialing process at a regular hospital, but it's
Right.
VA specific.
Right.
Okay. Yeah, makes sense.
But the good thing about OR tracks, I will say, I mean, obviously, yeah, it's a pain, it's an extra step and everything else, right? But you only have to put in those base credentials once, and then everything else, you're able to access all the VAs that are signing up. And in the last 2 years, that number has grown exponentially. And
Okay.
there's also other civilian hospitals on there too. So for you guys, for everybody that works in the commercial sector as well, there are opportunities on the civilian side to use that as your vendor credentialing platform.
Okay. And it's called OR Tracks.
Yeah, TRAX. Yep.
Okay, thank you.
Andy, hey, Gene McCown, Memphis. Quick question: is this pretty much like the old Rep Tracks system we had to deal with in the OR? The same type of thing, or is it just they've changed to that? They change all the time.
Yeah. Yes. Yeah. Very similar to that. They used to work with Simpler Life was the old one, and that was about. I mean, each rep was about $1,200 on Simpler. And just like like Blake said, I try to stay away from the ORs, or I'm not in the OR specifically, but I use, we have to use it.
But OR Tracks will cover us completely in a VA, correct?
And if you have a question, so Gene, so what area are, if you tell me, or if you email me, offline here, we don't have to bog down this meeting with it, your area, I'll go on my OR Tracks to see if your VA is on that platform already. Right. So I can give you some intel without you having to go in and spend some money. But
our VA's on it. I'm in Memphis too.
Yeah. So John, I will tell you one thing though, is getting to the VA, like call ahead and work through the administration, right? Try to get in there and ask those questions and go to the prosthetics group first. That's one thing that's worked for me, is going to that ordering arm and just understanding what you need to do to get through that gatekeeper to be able to access those clinicians and not get turned away.
Great. Thanks, Andy.
Andy, this is Van. Go ahead, Stefan.
Wendy, you might just relate your experience here the last few weeks.
Sure. Yeah. For San Antonio, surrounding VA out in the Hill Country in Kerrville, Texas, I had to register through OR Tracks, just as everyone has indicated. I made 6 months of attempts trying to get in to see the clinics, the VA clinics that weren't a part of the hospital, very unsuccessfully. I mean, I thought I was good at getting beyond the gatekeeper, but apparently not with these guys. I guess they do keep our country safe. And so, so going through prosthetics, found got the person's name, emailed him, his admin emailed me. Here's the information that we need you to fill out. You need to make sure you have this, that, and the other. We've checked all the boxes there. Submit it to me. And then I submit it out to a board. If the board is interested in the product, we'll schedule an appointment for a presentation. So that's where we are. We're waiting to hear back from them to see, what their level of interest is.
You're going through, Wendy, the new product, like the new product committee. Some places call it that. Some call it the CPRC.
Probably.
Which only meets, once a month for an hour. And you get, they have a list of products. I'm somewhat cynical on the VA too, because of what you're dealing with. It can be a challenge, but once you're in and you got the platform going, it is a rewarding process to be able to get veterans in need the technology that can help them improve their lives.
If I could make one quick comment, I would look at the VAs, and when I called on the VAs, we just look at the prosthetics department as a purchasing department. Would be in the regular hospitals that we've always called on, the purchasing and materials management, whatever they're called. And over the last 20 years, we've all had to be part of rep tracks or OR tracks or one of those things. So we all spent a big part of our careers trying to avoid the purchasing department, but the VAs, it seems like the way to go is to, as Wendy's, it's taking time, but to get through the prosthetics department as if it was just like a purchasing department in a hospital.
Andy, thank you very much. You've been very informative, and I think, Evan, if you want to remind me tomorrow, we'll get this. I think we've sent it out once, but we'll send the form out. This is a form that GS2 Global put together for the VEINOPLUS product, and it's a great one-page handout. I think it's very well done. And Andy, as you said, any questions, we can forward the questions to you. If they send them to our marketing department, or they can contact you direct. I'll make sure that your direct email is available for everybody. And I think the Veterans Administration probably offers the greatest potential because, one, you've got a group of patients utilizing the VA, very high percentage of people that could utilize the VEINOPLUS technology and really would improve the quality of life. So I think it's a wonderful opportunity for us. There's some rigmarole that we have to go through, but that's true in anything. So, any other questions for Andy?
Yeah, this is William down in Miami. How's everybody doing?
William, how are you doing?
Good, great, thanks. So a quick question. I know we're all dealing with this together, and navigating the VAs can be challenging based on the different facilities and maybe not abiding, by the same protocols nationally. My question is, on top of getting the OR track credential and a couple discussions that I've had with Vin on the VA, based on the FSS number that we have, if we get an appointment with the clinician and we get past that gatekeeper and we have an appointment, et cetera, is the actual, because some of these VAs, based on my research and conversations with other reps in the past, have mentioned something about an actual form where they want us to fill out our information, or company, independent contractor with our distributorship, or does it go under the GS2 FSS credential? They want a background, and there's additional information such as they want an address, they want information with a DUNS number. It's all this additional, I guess, questions that they're asking the vendor. I don't know, is it directed to the company with GS2, who's the FSS number with the product, or is it through the individual contractor like myself and my distributorship information? And as far as that background with filing and wanting a DUNS number and some other additional information, it's a little confusing. I know you probably can bridge that once you have a credential with OR tracks. They probably won't even ask you that. But I'm just curious if anybody's experienced having to go through a background and any other additional information from the vendor, specifically's distributors' information, and actually inquiring about a DUNS number and some other things like that.
I'm doing it right now, William, for the San Antonio VA. So we've whittled down the documents, what we're presenting to them. So that's something, Stefan, that we could probably put together as a packet. Here's the documents, that you'll need that are probably being requested. And I can, help people with a drafted email as well. But yeah, typically they're going to ask, the questions going to come across, hey, what's your background, this, that, and the other. And we're sending the information on the VA with the vendor file entry request form. Information GS2 is registered with the VA on the federal supply schedule. So that's who the background information is. And then information on VEINOPLUS. So when any of y'all get to that spot, we can certainly help you. I think we're ahead of you, that we have those documents already pulled together for you.
Okay.
This is the page, the one page deal that basically I don't know if you can all see it, but it's basically the form that they requested in San Antonio. If they'll require more, we'll find out and we'll share it with everybody. But it's a process, and I think the opportunity there is tremendous. It really is. And I don't know, is Taft, are you available? I don't know if he is or not. He was where he couldn't talk. I think he's listening. But
Yeah, I'm here. I've got about 3 or 4 minutes, and I've got a bolt.
You've worked with the VA in the past a lot. Do you have any comments or any additions that you think would be appropriate?
In regards to access, a lot of this credentialing is new in the VA compared to when I used to be there. Because back in the day, you could just roam the VA; it wasn't a big deal at all. So, and I'm in the process of finding out. I mean, I've gone to a couple of VAs so far, and I haven't run into the credentialing thing. But I'm being honest with you, I haven't even looked for it. But nobody said anything either. So I don't know. It's changed a lot. They've become more almost like a commercial hospital in regards to credentialing. But in regards to calling on the VAs, of course, the big call points are going to be vascular and podiatry and wound care, physical therapy, and primary care as well. So I think those would be your hot spots in regards to your call points.
Sure, William, make a comment on William's question. William, so I guess what Wendy got was from the procurement department. So when you get to the procurement department in that particular hospital, they will probably give you the form that they gave Wendy that will provide, and then we'll have the packet of information to send to you that we are completing right now. So
got it. That's helpful.
That might clear it all up for everybody.
Yeah, totally.
Great.
Andy, thank you again. And I think now, we're about 10 minutes from our quitting time, but let's any questions anybody has today, and it doesn't have to be specific to these three topics. Why don't we spend a few minutes and answer questions? Then, like I said, anything that's not covered, please send it to the marketing at dynapulsemedical.com.
So, Stefan, it's Blake again. I have a question for Andy. Andy, what departments, once you get approval through prosthetics, where do you see this in the VA? Is it any different than outside of the VA, private sector? Do you see like podiatrists going towards this product, or like what are your thoughts?
I could see, every civilian sector that you're going to see within the VA is going to be a prime market, right? Specifically your podiatrists, your vascular surgeons, because those do exist. Not every VA has them, so some VAs do outsource that. I just be upfront on that one. But one area that I would absolutely hit is going to be what they call PM&R. So it's pain management and rehab. And that group covers a whole host of issues, from those that are quadriplegic, have amputees, spinal cord injuries. So some folks that have lower leg edema, as well as are wheelchair bound. So definitely are experiencing disuse and atrophy. But you can also go into the wound care department, so that they can help generate additional blood flow to get down to the lower limbs to accelerate any wounds that they're dealing with on the chronic side, because the podiatrist will pass them off to the wound care group specifically, especially for those chronic diabetic foot ulcers, to go over. So yeah, that's the area that I would really focus on. Also, I mean, an area that doesn't get hit often is endocrinology, which sounds a little bit different, but those individuals are also dealing with circulatory issues.
Sure.
So that is a place to go. I wouldn't rank it at the top of my list, but it is a place to go to nonetheless.
Yeah, no, that was super. That was a great answer. Thanks for answering all that.
Yeah, no problem.
And one of my top prescribers is an endocrinologist here in San Antonio. So
I was just going to ask you that, Wendy, because you've kind of pioneered. It's if you're treating diabetes, you're treating some terrible issues that they're going to be facing, and the LU study addressed that because that was where we were able to restore circulation in diabetic feet where the circulation had stopped. So I think that's another excellent call point. Any other questions this afternoon? If not, again, thank you, everyone, and we would welcome your suggestions for the meeting next week. We have some thoughts, but we wanted to readdress the billing part, let you know what we were doing and what we're trying to do to make sure that the patient benefits. We want to go out of our way to make sure that the doctors know we're doing everything we can to get the prescription filled. And if you have any comments on anything else in terms of the 2 documents we sent out, hopefully they'll be helpful in addressing some of the issues that we're dealing with every day. And Andy, again, thank you for the presentation you put together. And I think, as Andy said, anybody wants to reach out to him, we have the address for him, his email and the GS2 Global. With that, we'll call it a day, I guess. And
thanks everyone.
Yeah, thanks, everybody.
Thank you.